Hello, good afternoon. Can you guys hear me? Barely. Okay. It looks like everything is maxed out. Can you hear me now? Is that better? All right. Okay, you have in your hands the new handbook for the Villages Rehab and Nursing Center. It's going to look an awful lot like the old handbook, but there are a few changes. So that's what I'm going to go through. We're going to skim through the changes so we can talk about it. And this is now. Did everybody see the insurance information from 2 weeks ago? And we passed out the paper on the insurance. So I am just waiting right now from the reps to get back to me as to what exact dates they're going to be in order to do open enrollment. So watch the back bulletin board for that. This is welcome. Welcome. I'll get to some yellows here. There we go. Okay, with this day and age of social media, I know you guys, a lot of you will take pictures in the facility, take pictures of each other, will tweet or Snapchat or I don't even know what else is out there. You guys? 18. Okay. So there's we've had to put in a few new policies on social media, on confidentiality and HIPAA guidelines. Hi, Henry. All right, so be sure that if you are going to post a picture on Facebook or Snapchat or wherever you're posting it, that it only has a picture of the purse of your friend, not of any residents that are in the building. We can't post videos of the residents that are in the building. We can't do anything that we don't have a release for. Remember, they're still private individuals just as you are. And you can't, be sure also not to post names of patients or anything that could help to identify a patient. Also, when you're looking at just a reminder, since we're talking about HIPAA compliance, when you're out, when you have charts out, to make sure you have them covered, the information covered, that you don't leave a chart on the table where everybody can walk by and look at it if you're not in the process of working on it. Of course, if you're in the process of working on it, you can keep it. If you walk away from your med card, be sure to have a privacy screen on there. Dress code. All right, personal appearance. It goes a little in detail. We still have it. I'm sorry, I'm not good at page numbers. 20. Okay. It's very common sense for dress code. You know, no spaghetti straps, no tube tops, no see-through clothing. I don't think we have that problem here. We actually, you guys are pretty good. We do have dress down day on Fridays, which is fine. Just no ripped jeans on dress down day. Make sure you cover everything up. No pants that are falling off or that that slip down. Showing underwear or what have you. No, we don't need that. Also, closed-toed shoes. Those are required for everyone, and it's slip-resistant closed-toed shoes. As you know, we've come into contact with a lot of bodily fluids and spills, and we want to be sure to not slip. This is for your protection as well. Also, piercings. Any piercings in the face, tongue, what have you. The tongue need to be covered up. The face, the tongue, I guess you have to remove. The face you have to cover up. Okay. Tattoos also. Just wear sleeves. to cover up the tattoos. Questions about that? We're still with a generation that doesn't quite respect that. Do you understand what I mean? I see the older folks in the room shaking their head yes, they understand. You're getting old, okay. Headsets, that's been a problem lately. No headsets on when you're working. No earbuds, no, I know some of them are Bluetooth. No headsets or earphones while you're working. It's important that we're able to hear each other and hear the patients, and that we're able to communicate. We don't have any distractions. There's enough distractions here to do that. Questions so far?
Yeah, the offensive logos on shirts, that includes the Seminole icon, right?
That's all. No, the gator.
Okay.
No, I'm offended by the Seminole.
Now, wait a minute. I have a son at FSU and a nephew at Florida State, that's a Gator, so at UF, so, well, I can't be biased. Oh, there we go. Okay, smoking. As you all know, no smoking on the premises. Tell me why this is. That you shouldn't come in smelling like secondhand smoke. Why is that? It makes the patient sick. That's right.
And the co-worker.
And the coworkers. There's a lot of documented evidence out there that secondhand smoke is more deadly than firsthand smoke. So you are making everybody else around you when you come in here smelling like secondhand smoke. So please make sure you keep it outside. Keep it, chew some nicotine gum, get some lollipops. We have several people here. The health department gives out free, quit smoking packages that include all of the above, patches, gum, lollipops that are all, there's multiple ways to hold off your urge until you get home. Tipping, it is the holiday time, and just a reminder that you're not to accept gifts from the families or from the patients. That's not, we don't want that to be a condition that of being treated well by them, that they...
Can we tell them to donate it to like activities or something like that? Are they allowed to do that?
The question is can we get them to ask them if they can donate it to activities? Well, of course. They can donate it to a resident fund. Or even, I know the Employee Recognition Committee was talking about starting a Sunshine Fund. Does anybody know what that is? Anybody know what a Sunshine Fund is? Have you ever worked on one? Okay, so a Sunshine Fund is the Employee Recognition Committee raises money, and in the money they put it into the Sunshine Fund. Then when we have an employee that it falls on hard times, that can't pay their electric bill or can't pay their rent, then then they apply to the Sunshine Fund group, and there's a group. It'll be a multidisciplinary group, and you guys would put it to a vote. It's an anonymous vote as to whether or not they should, and they are presented with the case without names. So then they're asked if they can, give some of that money, and how much money is what they determine that they want to give out of that fund. Is that something you guys think would be a good idea? We can take care of our own? Anti-discrimination and anti-harassment, this is not new. However, it is something I think that always needs to be gone over. It's something we have to do annually anyway. So this is one of our annually required in-services, in fact. I need to pass around a sign-in sheet. Brent, can you help me? Okay, so who can give me examples of things you shouldn't do at work? Huh? Who can give me examples of things that you should not do at work? Sleep, okay. What is harassment? Okay, you shouldn't have relationships with residents. That would be a good one. No unwanted gestures, no saying things to people that don't necessarily want to be said. You know, please refrain from gossiping and talking about others behind their back. If you can't say it to their face, then don't say it at all. Is that just normal? What else should we not be doing? We shouldn't threaten, call names. Swear, that's right. No curse words in the facility. That's not professional, right? Raise your voices. We shouldn't be doing that unless there's an emergency, a code blue. Then we can shout that. What else? So who knows who to go to for harassment complaints? Human resources. You would go to Arlene first. Yes. For employees. So if you guys feel like you're being harassed by somebody, either sexually or otherwise, then you go to Arlene. And if you don't feel like you can go to Arlene, you can come to me. If you don't feel like you can come to me, then we do have a hotline here, and they are independent. Okay?
Go back to that, David.
What's that?
Go back to reporting procedures.
Reporting procedures? Yes,
Yeah.
sir. That's page 27.
Right. But you see what number 1 says?
All harassment complaints should be taken to your immediate supervisor. However, if the person at whom the complaint is directed, you can submit it to Human Resources or to me.
Mm-hmm.
Yeah. Okay. Let's see. Attendance policy. Okay, in 2016, we're going to be enforcing, not only 2016, but in 2015 as well, the rest of it, our new attendance policy. So our attendance policy says no more than 6 call-outs total in a year, no matter what they're for. They're not for, there's no unexcused absences, there's no excused absences, and there's no unexcused absences. You must call in 4 hours prior to the start of your shift if you work 3 to 11 or 11 to 7. And you call in 2 hours if you're working 7 to 3. You don't have to call in 4 hours for 7 to 3. Don't call me at 3 a.m. All right. And you must speak to a supervisor or to the on-call person. You cannot call in and talk to just the receptionist. That's not considered a call-in. Well, then you leave a message, because we can get it off the message. Okay? Yep. Call-offs on a holiday. Legal holidays, if you call up on a legal holiday, it could be subject to immediate termination. We're taking care of patients here. So you know, it's very, very important. I know that all of you guys like your family time, I do too. But it's important that we are staffed and we can take care of the patients also on holidays. And if you work on a holiday, you can also take PTO day for that same day. So you can get double time for your holiday on that particular day. So if you want to work a holiday, then you can also get PTO time. Everybody understand that? You know what that means? Okay. Okay, also if you have PTO scheduled for the holiday, but you call out the day before or the day after the holiday, it could negate your PTO. So it could make you not eligible for PTO around the holiday. Yes, ma'am.
Are we still able to roll 60 hours of PTO over the next year?
You are. Yes, you are. And that reminds me right now is PTO cash out. So you can cash out PTO time up to anything over 60 hours you can cash out at 75%. So you just give the information to Arlene and then she can cash you out for your paid time off.
Is that in our book as well as money that?
Yes, it is. Also, there's a sign up right now for it, so don't miss that. It's only during this time of the year. Okay, so paid time off. So after 90 days, you get 20 days for the year. At the start of 4 years, what page is that? Okay, thank you guys. At 5 years is 22 days, and at 6 years is 27 days. Okay, so that includes holidays and vacation time as well. That's everything put in together. So 20 days a year is 4 weeks of vacation. Alrighty, so PTO eligibility. If you request a vacation, and like if you request a vacation next week, let's say Jennifer requests vacation next week, and then I call her because I'm short, because I can't get anybody to cover her shift anyway. So I call her and she comes in, then she can get her vacation time plus her hours as well. So, oh, nobody wants Jennifer's card. Okay, this is something new for PTO donations. If we have a coworker that's in need, then we can donate PTO time to them. Now it is in writing. And we had the management company wouldn't let us do this before, but I put it into place with us. And so if we have a coworker who's out for an extended period of time, then we can donate our PTO time to help them out. And it really helps, Jennifer says. Jennifer was the first recipient of that policy, actually. All right. Yes, ma'am.
I have a question. If you donate your PTO time, whose rate is that at?
It's at your rate.
Okay.
Yes. Yeah, it doesn't. That's a very good question. It is a very good question. Yeah. So if you donate, if a nurse donates time to a CNA, then it's going to be, her 8 hours could be that CNA's 12 hours. So that's, yes. Yeah. Vacation. Huh? That's right, you got to get sick first. Oh, she's getting sick now. Okay. All right, so vacation time. Vacation time, because of the holidays and everybody wants to take holidays, no vacation, and we put it in the handbook. It's been posted on the back bulletin board for about 3 years now, but it's now in the handbook. Vacation shall not be requested during the week of Thanksgiving or from December 23rd to January 2nd. And so that's, you can request a day off here and there, of course, but not a whole week, not the extended period of time. And that's so that we can staff and we can allow everybody to have time with their families during the holidays. This is new, it's something I wanted to add, that it's domestic violence leave of absence. We've had a number of employees who needed some time off because of domestic violence and they wanted to relocate or they need to get their children out of danger. So you're entitled to 3 days of leave when that should occur, so that it's not considered an absence when that occurs. Work-related injuries, you have to report them as soon as they occur. Everybody knows how to report a work-related injury? You guys know how to report a work-related injury? You do an incident report. Uh-huh. An employee incident report, they're in all the drawers. So just make sure you get one out. And if you can't find an employee incident report, then do fill out a regular incident report. Just make sure it gets reported because we want to make sure we cover you. Okay. Of course, the disciplinary procedure and policy is still the same. Okay, so the last page is your signature and acknowledgement that you received the handbook. I need you to sign that last page and turn it over to Arlene. We're anxious to get to that. I am too. We saw an incredible demo on it yesterday. We have a timeline that within the next 2 months we will be fully electronic. So we're going to stay tuned for teaching. We also have, I signed up for educational modules that you can do at home or here on the computer. So you're going to do everything on the computer and practice, and then you'll take a test at the end. So you have to be proficient in that skill before you go on to the next level. We're using point-click care. Yeah. So we will be using point-click care. CNAs, your care tracker will switch to the point-click care. So it's still going to be on the kiosks, but it'll be more integrative with the point of care. So you'll be able to exchange messages on your kiosk with the nurses. And the nurses can give you information from their laptops and from their MARS. So there won't be any more changeover to do. And it'll also be integrated with the pharmacy and with the physicians. So the practitioners will actually be able to write an order, and it'll come to your MAR. You'll have to confirm it. As long as you confirm it and it meets all the criteria, it'll go directly to the pharmacy automatically. Pharmacy will send it to you, and it'll appear on your list. It gives you a little bit of time. It doesn't start until, it has different cutoffs, and we'll have to assign the cutoff. So it'll be assigned at a certain time. It might not start until the next day, 9 a.m. or when have you. Yes, sir.
Will the doctors be putting in their own stuff, or are they still writing POSs and whatnot? Or when the doctor writes the order and the flag and all that jazz?
Yeah, they'll be
They're still
writing.
doing that, or are they giving them a keyboard?
We're going to give them a keyboard. However, as you know and I know, some will do it and some won't. Some are more electronically savvy than others are. And we're going to make it very easy for them. There's a list in this of like 20,000 drugs that they'll just be able to click Celexa, and they'll find the dosage. So it won't be so hard. They're not going to have to type it all in. It's going to come right up for them. And so we're going to try and encourage them to do this. Right now, I think, of course, the ones that are using the Metaprosity will probably use it right away. Then we'll probably have middle adopters and then some late adopters. But we'll definitely be working on it. And I think it'll be a much better system for communication back and forth between all staff. Christmas. We do, let's see, I think Danny's going to be going around with the neighborhood list so that you know which neighborhood that you identify with. Does anybody know which neighborhoods they're on, or?
Four.
Okay.
All of them.
All of them? No. Alrighty, so because each neighborhood will have $800 to spend on a Christmas celebration. And so you guys will have to get some committees together and decide how you want to use that money. You can use that money any way that you want to. But I believe Danny's going around figuring out who's on. We'll go around and make sure that he knows which neighborhood you think you're on. So and then we'll give the list to each neighborhood. We'll do that by the end of the day tomorrow. Also, there's been some rumors going around and some stuff going around about the Christmas bonus, or the yearly bonus, the annual bonus, I guess I should call it. And there is an annual bonus coming. We're giving all the full-timers $100 and all the part-timers $50. That'll come on January the 2nd, because that's when the accountant told me I could give it. And what's that? Tax-free. It is tax-free, actually. Yeah. Well, I pay the taxes on it. All right? I mean, nothing is tax-free. Don't tell the IRS. In other words, it will be a check for $100. It will not be a check for $78 because Uncle Sam got 22 of it. All right? Yes. No. So yes, I am paying the taxes ahead of time for you on that. And regardless of what everybody is saying, because I've heard all kinds of rumors that this is related to whether they did their care tracker, or whether they did their charting, or whether they did their skin checks. But yes, I want you to do all of that, but it's not contingent upon it. It's a thank you from me for working hard this year, and I appreciate it. And I hope to do more next year. UltiPro. Is there anybody able to get on the system to get their paycheck stubs? Oh, some of you are. Okay. All right. If you're not able to and you need it reset, and then I need you to, here, we'll put another piece of paper out and you sign up on the next piece of paper. Okay. Wait a minute. All right. Alrighty, and I'm going to close with a little vignette here for you, a little short story. So, anybody know what the Cherokee Indians' rite of passage is for their children to become men? The Cherokee Indians.
Say it again.
Does anybody know what the Cherokee Indians' rite of passage is?
Yeah, vision player.
No? Alrighty, so how does it work? So a Cherokee father takes his son into the forest, blindfolded, and leaves him alone. The boy is required to sit on a stump the whole night and not take off the blindfold until the ray of sun shines through it. He is all by himself. He cannot cry out for help to anyone. Once he survives the night, he is a man. He cannot tell the other boys of his experience, and each boy must come to his own manhood. It is terrifying. One can hear all kinds of noises, beasts all around. Maybe even some human would hurt him. The wind blows the grass, the eerie sounds abound, but he must sit stoically, never removing the blindfold. It is the only way he can be a man. Finally, after a horrific night, the sun appears and he removes his blindfold. It was then that he will see his father, sitting on the stump next to him, at watch the entire night. We are never truly alone. Even when we do not know it, our family and friends are watching out for us, sitting on a stump beside us. So let's keep sitting on that stump for each other. Thank you, guys.